We are now on a parallel session, room 380, and it is called New Tricks, How to Change Healthcare Workers' Behavior. All right? We're in the right session, right? Okay, so let's begin. You know, almost 20 years ago, I spoke in a seminar, and also I wrote that really the new frontier for infection control is managing human behavior. All right? And I think even then people believe, but right now it's very clear. We know so much, and yet we cannot manage to change or implement the policy because we just don't know enough about human behavior. So today, we are really on the cutting edge with 3 great speakers, and without much further ado now, after each session, we'll discuss a little bit, because I think it's quite sort of contained within each section. Now, I myself do not fully know what is the topic on the first session, on the first speaker. Exactly, I know that the second is human and the third is patient. But the first speaker is going to speak on hats, which will be very important, and it's a great pleasure for me to introduce Andreas Voss. I would say an old friend. We have worked together many years, and although he's from the Netherlands, from Radboud University in Holland, to me, he's the European, right? He's all over Europe, and really he will tell us, hats, the problem. Why don't healthcare workers listen? Ladies and gentlemen, Andreas.
Tito, thank you very much, ladies and gentlemen. Once again, I'm really sorry about the typo in the program, but hats actually can be a problem with listening, especially if you're having this kind of type of model. Anyway, yesterday Sir Liam talked about patient safety and the airline industry, which is a complete different field, it seems. Some of you might have come here on this airline. Low prices, safety is possible despite all the low prices, and it usually goes back. Sometimes I have a little problem, but they are completely safe. Why don't we have this kind of a culture in healthcare? If a pilot would not agree to the checklist or decided on one day to only go to 90% of that instead of the acquired 90, and I hear due to cost savings, by now it's only 98%, but if he wouldn't go to the full percentage he's needed to go to do, he would be fired and would be leaving, out of a job. So the question is, would you trust these people to fly with them? That is the main question, put their hands in their lives. And why aren't our healthcare working actually doing what we asked them to do? And this slide is from Jan Kleitmans, this slide I got from him, and it's typical for how you go and how healthcare workers react to infection control. It's a barrier in your way they don't like, and they of course find the right way to manage this barrier. And it's not sticking to the guidelines, but finding a shortcut anyhow and anywhere. So why is that? Because it's my opinion is we are dealing with a very difficult microorganism. Actually, it's more a macroorganism, I would call it. I call it the multi-resistant medical specialist. And this is a problem what we have to deal with. And this is a very species which is resistant to good advice, allergic professional guidelines, non-compliant with infection control, blind to nosocomial infections, and have complete other priorities. And infection control most certainly is not part of that. This is the head of a Dutch neonatal surgery unit, newly appointed professor who decided to be on a paper just like that. So why are not even the key people doing what they're supposed to do? We invest into operating rooms, enormous amount of money into the ventilation system, to only find out that 80 times during thoracic surgery, the door will be opened for important messages like Ajax scored the second goal or something like that. So it's completely ridiculous. Why are we doing this? Why are we acting like that? We heard yesterday in the opening, Semmelweis obviously was the one who saved the mothers, who introduced hand hygiene into healthcare. So we should assume that our healthcare professionals love him to death, but actually they don't, and we all know about that. Why is it they don't listen? And this is the answer. I hope you can see it clearly in the middle of my slide. If you don't see it, because that's our problem. Microorganisms are non-visible. If microorganisms would like this on your hands, then we wouldn't have a problem with compliance with hand hygiene. The problem is it's invisible, and therefore we are in trouble. What is the solution to the whole trouble? So it's a problem about the combined, I don't know, I don't have the resources, I don't do it. And there are 3 ways of combating that. It's education, system change, and motivation. If you think about education, it seems extremely easy. I mean, why not? We are all highly intelligent people within the healthcare settings, so it shouldn't be any trouble to educate this kind of people. But we all know how difficult it is, so we have to do something about it. This is from a nursing journal in the Netherlands during SARS. So it's important that what you see is educational, and as you can see here, obviously they had no clue how to really use personal protective equipment. And they put it on the journals and in the journals. So education is extremely difficult. This is from a hand hygiene campaign. And it's a great slide. I mean, I love it, I really do, because there's absolutely anything wrong. What you can do wrong with hand hygiene is depicted in this picture. And unfortunately, their slogan, "Everybody does it," is probably right. So it's not the way we would like them to do it, but it's most certainly. But this is, if you educate people in the wrong way, how do you expect them to actually act right? This is one of the techniques, probably the best you can see, with black light and chemiluminescence, where you can see how badly you disinfect your hands, where you can see that the thumb and this part of the skin are not even touched. This is something that makes hand hygiene visible. This is a tool that I find very helpful. The system change. The whole idea behind the WHO guideline obviously was the system change, the switch from water and soap to alcohol, hand rub. And Didier already showed this picture in his opening where he said, the more intense your work is becoming, probably the lower is the compliance with hand hygiene, and we all know those data. So what is the problem? The problem is that we have no time of hand washing. This is a paper of Andreas and myself, where we actually measured in super modern intensive care units. There are 12 healthcare workers, 2 are right here in the front of the bed, taking care of this patient. And you might see the thing in the back of the ICU. If you have to go, you go all the way back, you wash, you dry, then you return, and then you hope that the patient is still there. At the same, luckily they don't run away in intensive care units, but at the same time it would be so much nicer to have hand alcohol rubbed at the bedside, and that was the whole principle. The 2 just have to turn around and then use it. And we actually calculated time. If you look, the 12 nurses in this ICU used, by 40% compliance, used 4 hours of hand hygiene. So if you now went and calculated according to the time the different measurements take, the compliance at 100%, this one, using alcohol hand rub, still is 4 hours. So you can be 100% compliant while being only wasting 4 hours of cleaning. If you do that with hand washing, 1 hour takes 16 hours of hand hygiene. Those 2 are all day long in the back of the room washing their hands, while the other 10 are working themselves to death. So hand washing is not working. It's impossible to implement. It's alcoholic hand rub on the side. The other thing is, if you expect people to do what they should do, you have to ensure that they have enough time, enough hands. There should be the patient to staff ratio, the patients to staff ratio needs to be at a level where people can actually do what we ask them to do, because any form of stress will kill infection control immediately. So we have to ensure the right structures, the right amount of persons. And last but not least, and that is the thing what we should do and what we are not really trained for, is good motivation. And you will find out more about this if you come to the Semmelweis Day, because this is a great thing. But here's Semmelweis trying to schlep one of the colleagues to disinfect the hands. And he kind of was maybe not using the right word, like disinfect your hands, you murderer, is not the best motivational talk you can have, unless you put it into subliminal messages. There you have to be threatening. But in other words, he might have taken the wrong approach, and we will certainly talk about more about it, but we didn't really brought us any further, in my opinion. So what can we do? We do have to learn that just by telling here something, a smart person telling you a nice talk, this will not change your kind of behavior. We have to go to marketing. Marketing knows what to do. You have to feel good, flattered, challenged, or sexy. The last one really helps, I would say, to change things. And the pharma industry recognizes it. Meet Anya. Yeah? Anya is a pharmaceutical representative, and yet she's selling drugs, and very successfully. And so successfully that other US-based companies used more cheerleaders as drug representatives. So what can we do to transport that into infection control? This is my new type of infection control person. since all the people in healthcare are mainly female, I changed the gender of my representative, but this is what we need. If you have an infection control like that, please send it to Nijmegen. So we need different kind of people, different ways of convincing. And then there is self-protection. Self-protection can be a good motivator. It certainly works, but I don't know if it's really patient-friendly. So how do we apply that? And this is actually a slide I got from Cito. Cito, it's your slide. I hope you recognize it. But this is a wonderful slide, because what it tells you that during the outbreak of SARS, which is this period of time, you see there's an enormous peak in acquired cases of MRSA. Why is that? Everyone was wearing gloves, everyone was wearing gowns, there was infection control like at no other time ever. So why do you still have transmission? Because they used it for self-protection. They never took them off, or not as frequently as they should. They did not disinfect their hands because they were wearing gloves and gowns all the time. So it's an important message that yes, self-protection may be very helpful, but it really doesn't help our patients. And that's what it's all about. So you can try to do something else. You can try to humor people, because sometimes that helps. So as you can see, this is a clear example here, and I wouldn't know a better one than Moses cut the bullshit and take your bath, is water and soap doesn't work. I mean, it was early documented, you could say. So we do need other products. This one was one which we developed for our own campaign in the hospital, I Love Hand Alcohol, and it was great. 80% of the people loved it because it was shortly before Carnival and they could take it along for their parties, but they were interested in the topic, and 20% hated it. They wanted us to get rid of those posters from the hospital. Hate and love, both are good. You want healthcare workers to feel something. If they're oblivious and don't think about anything, then it's when we have trouble. So it was a great campaign. And then, if you have no sense of humor, and I won't name any nations for that, but if you don't have any sense of humor, then you return to force as a motivator. You say it's an institutional must, we just have to do it, and you observe, and you give warnings out, and then you decrease their salaries, and you actually fire people if they don't comply, and yes, strangely enough, you get 100% compliance. Is it the world we would like to live about? I don't know. On the other side, airline industry is using the same approach. So why not healthcare? Yeah, you can do it by litigation. And that is another problem. Yes, it's nice. It's providing a safe environment for patients is something a hospital has to do. If you have no hand alcohol dispensers in your hospital, then it's a hospital fault. You are not doing hand disinfection, not the personal fault of the healthcare worker. So we should think about that. And Don Goldman wrote a wonderful paper about personal accountability in the cases of clean hands, and I like it. He's pointing out, yes, as a healthcare worker, you have a personal accountability, and you should look for that. And you have to decide between the two different things. There are mistakes in the system, like not enough people, bad education, no access to hand rub, and there are violations, ignoring the fact that you actually have to disinfect your hands. And we should not tolerate violations by our healthcare workers. And other industry, and you could say airlines, is important, but computer chips. If you work in a computer company where they make chips, they will not accept you ruining the whole batch of chipses, and there's just an economic loss, no lives at stake. So it was a really good paper by John, and we should make healthcare workers accountable and feel responsible. Patients' involvement. And this maybe is not the opinion of WHO, but I like George Anna's paper of the patient involved. They cannot and should not be responsible for their own safety and environment over which they have no control. And I kind of cannot not stop myself from agreeing with George Anna's with this quote. So how much do we involve? Yeah, we should involve patients somehow, but we have to make sure that we stay in control and they shouldn't. So how can we make infection control stick? What is it what we can do in the end? And I have to, it's really complex. We know that. It doesn't help to work on a single measurement. It doesn't help to set up randomized controlled trials about single measurement just to show that they don't work. We have to think of the multimodal approach, and Didier was the first to do that. But we have to do a few other things. We have to keep in mind the view of others. So this seems to be an easy game for a little boat, but those people we help might have a completely different perspective about how they see that. So we have to keep others in mind when we do our own work. We have to offer education. And I already said, education seems easy, but I have shown some examples of how difficult it is to do education well. So we have to ensure that the high quality of education, we have to make sure that our rules we implement actually make any sense. And I'm half German, or in my back German, so I know about senseless rules. So we really have to ensure that they all are needed. And this is something, an idea I copied from Barry Cookson. We have to keep the cultures in mind. If you see a traffic light, in England it's mandatory, in France it's a suggestion, in Italy it's a Christmas decoration. I mean, so we all see the same thing, but we get complete different ideas about what actually is going on. So please keep the culture in mind. And the last one, I won't show the movie out of time reasons, but we have to encourage healthcare workers to continue to think despite guidelines. This is a nice movie you should look up on YouTube of Miller Twist. This guy is like dancing, he's twisting about half an hour, dancing the twist in front of the bottle, and guess what? It doesn't open. So despite clear instructions and guidelines, that doesn't save you from actually thinking about it. And last but not least, be consequent in all what you do. Trespassers, violence will be shot. In the Netherlands, we are very consequent. We also shoot the survivors. So just make sure that you're consequent in everything you do. And last but not least, and I'm coming back to the airline industry where it all started, they make different promises. This is a typical mother when a kid doesn't like the food. You all know it, the spoon, and here comes the airplane. And it's really fantastic, but what do we achieve? First, the kids won't eat what we try to get, but they all think that airplane food tastes like crap. So thank you very much.
Andreas, I'm glad you reminded me that you used some of my old slides. Because I really want all those cartoons you have in your... Every one of them, right? Okay, any questions? Any question? Well, we can have more discussion at the end, but just a quick one at the moment. Now, this is a great presentation, Andreas, and one of the big things about behavioral change in infection control is that the focus on hand hygiene is that it is unique in the sense only basically one patient care practice. But in the actual ward, you know that, in fact, if you look at the CDC guidelines and put it all together, you have over 200 patient care practice. It's a complexity of activities. Yeah. Can you comment on how do we then get compliance in this kind of complexity? It's not just one action, you see.
It's true. It's different actions, different indications, and we obviously did a lot of research on hand hygiene and which are the good indications. And I think that's why we came up, and WHO came up with the 5 moments. I mean, the world out there is too complex to at any single minute decide and teach all the different people, because what you didn't mention yet, there are all different level of people and healthcare workers too. So I think by just categorizing it well, and Hugo is sitting there, he's now moving to 4 movements, but he's had different models too. But anyway, by making the world easy, by creating guidelines that are generally applicable, and then you will have discussions forever, but yeah, in that situation, maybe it's not needed, or this. We have to make easy, accessible structures, and that's the only way to go, in my opinion.
Yes, okay, thank you. Well, we can discuss some more, so Andreas will be around. Well, it's a pleasure. Anyway, I forgot to introduce myself. My name is Sito, and I'm from Hong Kong, all right? Not in Europe. That's why I introduced him as a European.